Now, I've been to the cross more than a few times in my life, and I know what great things they do. So I'd like to invite Dr. Larocque to come up and talk about what they are doing right now that might change the game for everybody. Would you please welcome Dr. Larocque? There's your mic.
Hi, thanks for having me.
So now you know a little bit more about me and my story and how important people like you and your machine is. So let's talk about Linac MR.
Right. So this is a picture of the Linac MR prototype that's running at the Cross Cancer Institute right now. So a Linac is the main form of radiation therapy that we give for all sorts of different cancer patients. But one of the issues is we can't see what we want to hit if we just use a Linac. So we need to use other kinds of imaging modalities with it. So first they used X-rays with film, and then it got a bit more sophisticated, and they started using a CT scanner that was merged with the Linac. And the CT scanner lets us kind of see a 3D picture inside the patient, but we're still using X-rays, so we're limited in terms of how much radiation we can give. And it's really good for seeing bones, but if you want to see the difference between prostate and all the soft tissue and lymph nodes around it, the CT scanner is not so good. So we want to put an MR together with the Linac. The problem is the machines are basically allergic to each other. So the MRI gives off a super strong magnetic field, and it totally interferes with the radiation producing machine. And this is a picture of my boss. So Dr. Falone is the inventor of this machine. So the MRI interferes with the Linac by producing that big magnetic field, and then the Linac is producing all kinds of radio waves, and that interferes with the MRI. So essentially the Linac MR is a clever way of combining these two things so they don't interfere with each other and they can work at the same time. So what this machine can do is we can take an MRI of the patient, see everything inside with really great detail, and so the doctor can see exactly what they want to hit, carve out exactly what the target is, and say everything they don't want to hit. And then we have a state-of-the-art radiation machine attached to it, and it can hit that target while hopefully avoiding everything else.
That's amazing. You said that your boss is the inventor. So you guys should take claim for a very special invention that might change the game for cancer and cancer research. How much is this baby worth, and what was it like developing it?
I couldn't even put a price tag on it. What I can say is that the Cure Cancer Foundation and this golf tournament in particular has been a really early and really big backer of Dr. Falone and the whole team, and has really kind of made taking this from something that was just an idea in a meeting room to something where now we're actually treating patients with this machine.
How long did it take to bring this machine into fruition?
I think it's on the order of like 10 or 15 years that we've been working on this.
So you've put a lot of work into this, and 25 patients benefited from this golf tournament, if I'm not mistaken. It allowed them to pay for the Linac MR to do some looking around.
Right, so the first models we had were just purely for research purposes, but now we have a full-scale human FDA-approved machine, and we're treating patients on a clinical trial right now. So clinical trial is done in phases. So the first thing we did is we started scanning healthy volunteers just with the MRI. We're not turning the radiation on. So we're just making sure we can see what we want to see. And then we recruited cancer patients who were getting normal treatment, and they would come in and they would get scanned without getting their radiation treatment on this machine. And again, we're just making sure we can see, now we can see cancer patients, we can see the cancer, we can target it. We're essentially doing a lot of dry runs, just making sure everything's 100% safe and working properly before we turn the beam on. And then just this year, we started treating the first cancer patients with this. So we can see their cancer, we line everything up, the physician is right there at the machine approving all the targeting, and when everything's lined up perfectly, the beams going on. So we've just started that this year.
How excited are you about the prospects of having this machine in use at the Cross?
Couldn't be more excited. This is essentially state-of-the-art cutting it in my field, which is radiation therapy. This is essentially the best of the best. So having this there is exciting just from a professional standpoint to be working on this, but also just having this kind of technology in Edmonton is really exciting and something we're really proud of too.
And you alluded to it earlier, just how much does this tournament mean to you people at the Cross?
It means everything to be able to do something like this. Is not possible without a charity like this helping along the way. So this is what we do our jobs for, is to do exciting stuff like this and improve things and hopefully improve outcomes for cancer patients. So I think something like this can really make a big difference.
See how much you can help in this process? Big hand for Dr. Larocque. All the best with everything. It's been a pleasure. Thank you very much.
Thanks very much.